National Electronic Health Record. One patient, one health record. The National Electronic Health Record, or NEHR, is a system that facilitates the seamless exchange of medical information as patients move across different healthcare settings. Mr. Lim is a patient suffering from type 2 diabetes mellitus, a disease he's had to manage for years. When his vision starts to blur, he decides to go to the nearby polyclinic for a checkup. The doctor reviews Mr. Lim's medical history in NEHR. Following that, the doctor requests for a diabetic retinopathy scan. His doctor suspects he may be developing diabetic retinopathy. The doctor refers Mr. Lim to the Singapore National Eye Centre for further testing. At the same time, at Tan Tock Seng Hospital, Madam Ravi is rushed into the emergency department after an accident at home. She slipped and fell, hurting her hip. The emergency doctor asks her about her medical history and drug allergies, but she was not able to provide the information. This is when the doctor accesses the NEHR for her previous medical record. The doctor immediately arranges for her to have an X-ray done. The X-ray reveals that Madam Ravi sustained a minor pelvic avulsion fracture. Surgery is not required and she is to be discharged to Ren Tze Community Hospital for rehabilitation. Madam Ravi's case manager is able to quickly review her case using NEHR and starts preparing the necessary documents for the transfer. Meanwhile, at the Singapore National Eye Centre, Mr. Lim undergoes a series of further eye tests. Armed with Mr. Lim's information in the NEHR, the doctor is able to avoid repeating previous tests done. The eye specialist reviews Mr. Lim's medical history in the NEHR. With the support of this information, he is able to make a quick decision on how to best treat the onset of diabetic retinopathy. The eye specialist sends Mr. Lim to his family physician at a family medicine clinic for longer-term management of his diabetes. Madam Ravi is transferred to Ren Tze Community Hospital. The doctor determines the course of therapy with the support of information from NEHR. After a short stay, she is discharged home. Now at the family medicine clinic, Mr. Lim's long-term family physician reviews his medical history and test results in the NEHR. He adjusts Mr. Lim's insulin regimen to better manage his diabetes. Today, both patients are well on their way to recovery. Thanks to the National Electronic Health Record, patients across Singapore seamlessly receive care from doctors at every step of their patient journey. The NEHR is building the foundation for connected health. National Electronic Health Record. One patient, one health record.